Hey everyone, this is Barbara Allen again from the APIC Kern Rivers chapter, recording the Certified Infection Control CIC study guide. We'll be talking about diseases today. So in general, we need to know the difference between infection and colonization. So infection is the presence of the micro in or on the body and they're causing the disease, whereas colonization is just the presence of the microbes without symptoms of disease. So before we start talking about diseases, it's important that we get these two definitions clarified. So we'll be talking for quite a while here about the bacterial diseases of concern. And then we'll go into fungal diseases, parasitic diseases, viral diseases, and lastly, prions. So this is a very long study chapter, so I would advise that you break it up and to study it in small sections. So you might want to just start off with the bacterial diseases. So as a review, bacteria mostly have a cell wall, and the cell wall does provide a barrier of protection for that bacterial cell, and we distinguish bacterial cells into gram-positive cells and then the gram-negative. Gram-positive cells have a thick layer of peptidoglycan and they stain purple, and there's a picture of the different types of gram-positive cells that we'll be talking about, primarily the Cocci and the Bacilli. So Cocci means sphere, Bacilli means rod. So that's what they look like under the microscope. So first of all, we'll talk about Staphylococcus. So Staphylococcus is the main organisms that we deal with, and they appear as a cluster of bacteria like you'll see here in this slide. They are part of the normal flora of the skin, and they also can cause rapid onset food poisoning. So if you have Staphylococcus aureus food poisoning, it's the most rapid onset of the food poisonings, with the onset of symptoms within 1 to 6 hours of ingesting the food. So a type of Staphylococcus is MRSA, methicillin-resistant Staph aureus, and it can cause a variety of diseases. Specifically for the CIC study material, we'll talk about CAP, community-acquired pneumonia. If a patient has hepatitis, infiltrates, or neutropenia, we might suspect CAP. Or cellulitis, might be MRSA cellulitis, but it's purulent drainage. Another type of gram-positive Cocci, so we're still just talking about those, is the Streptococcus bacteria, which looks like a chain. Also part of our normal flora for the skin, and this organism is capable of penetrating the intact epithelium of the conjunctiva or the cornea. Group A Streptococcus is a cause of pharyngitis, but can also cause scarlet fever, especially if the strep isn't treated in strep throat. Scarlet fever can be very serious. It's characterized by a diffuse red rash 1 to 7 days after exposure. And then group B Streptococcus, we always think about in terms of affecting the pregnant women that we are dealing with in our labor and delivery wards, and it can be transmitted from mother to infant during labor, and this is why we always test for GBS, as you'll see it dictated, because we don't want to have that transmission to occur. Another gram-positive cocci are the two enterococci. So Enterococcus faecium and faecalis. Now these also appear in chains, and like I said, they are gram-positive cocci that you need to be aware of. So now the gram-positive bacilli, so different picture here, it's more of that bacilli shape, specifically the Clostridium. So a lot of times in our gram-positive bacilli, they're capable of spore producing and they are anaerobic, specifically here with the Clostridiums. First we'll talk about Clostridium botulinum, and so we can denote that with a capital C and a lowercase species name for simplicity. So C. botulinum or Clostridium botulinum does cause botulism. It is a neuroparalytic agent, toxin that is released, and it causes blurred vision, dyspnea, dysphagia, paralysis, and it can be used as a potential bioterrorist agent. And then we're very familiar, of course, with Clostridium difficile, which, like I said before, it is spore forming, and the spores can live in the environment for an extended period of time, making it difficult to kill, and we have to make sure that our cleaning efforts are effective. Can also cause pseudomembranous colitis, which is a very serious disease that our patients may get from a C. diff infection. Causes two toxins, toxin A and B, and patients that are at risk of developing this type of infection include antibiotic exposure, exposure to PPIs or protonics, GI surgery, irritable bowel disease, exposure to healthcare, so they've been in healthcare either in and out a lot or just one prolonged stay. They have a chronic disease or immunosuppression, and they are over 65, so age is a risk factor for C. diff as well. Transmission of C. diff can be reduced by hand washing with soap and water, and definitely through environmental cleaning, which we have to be very aggressive with due to the viability of the spores for so long in the environment. So we'll talk about the gram-positive bacilli some more, beginning with Bacillus anthracis, which is shaped like a boxcar. It is another spore-forming organism. It is the causative agent of anthrax and does occur naturally as a skin disease. However, it can also be weaponized into a bioterrorism agent, and as a bioterrorism agent, it's generally aerosolized, and this would then lead to severe pneumonia, which is not contagious. Then we have Corynebacteria diphtheriae, which is a organism that causes diphtheria, and it can penetrate the intact epithelium of the conjunctiva or cornea. And now we'll talk about Listeria monocytogenes, which is a foodborne illness, also capable of penetrating the intact epithelium of the conjunctiva or cornea. It's an intracellular pathogen, meaning that the bacteria lives inside of the cell, the host cell, and it is going to contribute to cell-mediated immune dysfunction. So there are two parts of the immune system, the humoral immune system and the cell-mediated immune system. The cell-mediated immune system does deal with those intracellular pathogens, and that occurs by the stimulation of the cytotoxic T cell from the helper T cell, and then the affected cells will be destroyed through cytotoxic activity. So now we're going on to the gram-negative bacteria. So those were all gram-positive, so now we'll talk about the gram-negatives. So again, as a reminder of the cell wall does provide a barrier of protection for the bacteria, and we use it to distinguish different types of bacteria. The gram-negative cell wall stains red, and it has a thin layer of peptidoglycan. So we'll be talking about gram-negative Cocci, gram-negative Bacilli, and gram-negative Spirilli. The first disease we'll talk about with the gram-negative Cocci is one of the most serious genre of bacteria, the Neisseria. So we'll talk about the gonorrhea first, which of course is a sexually transmitted infection that can penetrate the intact epithelium of the conjunctiva or the cornea. And there's a picture of what the Neisseria cocci look like. And then Neisseria meningitidis, again, very serious infection. This is the bacterial meningitis that we all worry about, characterized by cerebrospinal fluid that is cloudy. You have a significant increase in white blood cells in that cerebrospinal fluid, increased neutrophils, decreased glucose, and increased protein. So when you're looking at your CSF results and you see, a very high white blood cell count, not a lot of glucose and a lot of protein, then you'd really need to be concerned and look at that stain to see if it's a gram-negative cocci. Neisseria meningitidis does require droplet isolation for 24 hours after the start of appropriate antimicrobial therapy. And we have to go ahead and prophylax the healthcare workers that were in contact with the patient's oral secretions without proper PPE. So the prophylaxis protocol is specific. It is only for healthcare providers who possibly could have been in contact with the patient's oral secretions. So if this type of contact does occur, you have to look at who was in their room and what their interaction was with the patient. And once again, it is capable of penetrating the intact epithelium of the conjunctiva. So now we're going to move into talking about the gram-negative bacilli. So the first one that we will talk about is Legionella. Legionella is the bacteria that is responsible for the disease Legionnaire's disease. Legionella does cause the Legionnaire's disease, which is characterized by a high fever, diarrhea, hypernatremia. It is linked to drinking water distribution systems like water faucets, ice machines, or water from respiratory therapy devices. It has not been associated with air conditioners nor IV solutions. It's an intracellular pathogen, and it is also going to then lead to cell-mediated immune dysfunction. More gram-negative bacilli. We'll talk this time about a whole bacterial family, namely the Enterobacteria ace. Honestly, if on a test you don't know what type of an organism it is, guess gram-negative rods or gram-negative bacilli. Bacilli is another name for rod. So we'll start with Salmonella. Salmonella does cause foodborne illness, and it has an incubation period of 12 to 72 hours and lasts for 4 to 7 days. That's another one of those intracellular pathogens and contributes to cell-mediated immune dysfunction. E. coli, another foodborne illness, an incubation period of 3 to 4 days, and it is a common cause of urinary tract infections. E. coli may become resistant to beta-lactam drugs, except the carbapenems. The enzymes are what confers the resistance, so the organism becomes resistant because it acquires the enzyme making it so. And there's a picture of our gram-negative bacilli, remembering that they stain red. More gram-negative bacilli, like I told you, there's a lot of them. Acinetobacter baumannii, it's an aerobic organism, and it's found in water and soil. Yersinia pestis is a coccobacilli, meaning it has kind of a shortened bacilli appearance, is responsible for pneumonia, pneumatic and bubonic plague. So this is the scourge of the Middle Ages, the Black Death. Bubonic plague requires droplet isolation, and it is another potential bioterrorism agent. Vibrio cholerae causes cholera, which is a waterborne gastrointestinal illness characterized by watery diarrhea, and another potential bioterrorism agent. And there's a picture to remind you of the gram-negative bacilli stained red, and they're that bacilli or rod-shaped organism. Next, we'll go to the gram-negative spirilli. Very interesting shape here that we have with this very unique spiral shape. We have the Helicobacter pylori, which is responsible for chronic antral gastritis and peptic ulcer disease. So sometimes you'll see that in lab reports. We know that it's probably peptic ulcer disease caused by the Helicobacter pylori. And then we have Variola, which is responsible for Lyme disease, which occurs in all regions of the United States except for the southeast region. Very important that we know about Lyme disease, Variola. Lyme disease is characterized by fever, fatigue, chills, headache, and a large annular lesion, which helps with the identification. So other gram-negative bacteria, we have our pleomorphic bacteria like chlamydia, which is an obligate intracellular parasitic bacteria, so it has to live inside the cell. We have the rickettsial group, obligate intercellular parasitic bacteria causing Q fever, Rocky Mountain spotted fever. We have typhus in this group. It is category B biological agent because it's relative ease in disseminating and moderate morbidity rate and low mortality. Then we have more of our coccobacilli, like the Pasteurella, which can cause cat scratch fever. And then we have Bordetella pertussis, which is an aerobic bacteria. Pertussis has an incubation period of 7 to 10 days. It has the catarrhal stage, beginning with a runny nose, sneezing, low-grade fever, mild cough, and then the proximal stage, which is the progression of the disease that leads to that characteristic whooping sound. Sometimes it's such high coughing that vomiting ensues and apnea. It can last 1 to 6 weeks, and if they do a culture test, it is considered 100% specific for identification of the organism. Continuing on with the acid-fast bacteria. The acid-fast bacteria are those bacteria that use a different type of differential stain, not a gram stain, but they have a waxy material in the cell wall, so we use the acid-fast stain. Notably of the acid-fast bacteria is Mycobacterium tuberculosis. To test for Mycobacterium tuberculosis, we use either the TST, tuberculin skin test, or the quantiferon blood test. The TST is an intradermal test for latent TB, is influenced by the BCG vaccination. This vaccine is not recommended for healthcare workers. It does test for past exposure to TB. Healthcare providers without symptoms but a positive skin test, not infectious. Healthcare providers with a negative skin test within 12 months should only require one skin test upon new hire. If they don't have proof of that within 12 months, then we do the 2 skin tests upon hire due to the booster phenomenon. The booster phenomenon occurs because a person's reaction to the tuberculin PPD can wane with time, and therefore the initial skin test may be negative. However, once injected, the tuberculin serves as a stimulus for the person's immune system, and it reminds the immune system that the TB antigen has been seen before. Therefore, when the second skin test is placed, it is subsequently positive. A skin test with a 10 millimeter reaction, meaning an induration, is considered positive for a previously negative healthcare provider. The quantiferon blood test is the second testing method that we do for latent TB, also is not influenced by prior vaccination. Past exposure testing should be administered at the time of the exposure and repeated 12 weeks later to look for conversion. So continuing on with Mycobacterium tuberculosis, if we're testing a patient for active TB and we're looking at the sputum, we want to get sputum cultures in the morning. Patients should be placed in a negative pressure room and wear a surgical mask during transport. Patients haven't been mask fit tested, so we put a surgical mask on them, and then staff that have been mask fit tested either wear the N95 or the PEPR. Screening for high-risk groups, like the homeless, may be done cost-effectively through chest x-rays. Another notable member of this genre is the Mycobacterium leprae. The atypical mycobacteriums, sometimes you'll see this as just atypicals, will be talked about in progress notes, or Mycobacterium avium complex is a type of an atypical, and you'll see that referred to as MAC. But the atypical Mycobacterium species are associated with ear piercings and require no special isolation or follow-up. May be found also in water. Mycobacterium fortitudium is a common cause of TPN contamination along with the fungus Candida. And lastly, Nocardia is another member of this acid-fast genre. Other bacterial diseases like the mycoplasmas have no cell wall. They cause mycoplasma pneumoniae, which is a primary atypical pneumonia, commonly found in school children. It is often confused with viral pneumonia. If we have patients with this type of infection, we need to place in droplet and standard precautions if they're symptomatic. So that is it for the bacterial diseases. This might be a good time to pause and study so that you can get a hold of all the material presented. But if you're ready, to fungal diseases. First of all, we'll talk about Candida. Candida is a common organism found in the female genitourinary tract. Cryptococcus neoformans causes cryptococcal meningitis, comes on more slowly than bacterial meningitis, takes from a few days to a few weeks and requires no special isolation. It's just standard precautions. The lab test of the CSF will show positive India ink, low glucose, and a predominance of lymphocytes. Then we have the Coccidioides species, found in the soil 4 to 8 inches deep in endemic regions which are arid areas of Southern California to Texas. This causes a lung disease and may disseminate to be extrapulmonary. Up to 50% of the population in these areas where the organism is endemic have been exposed to the spores. Parasites. We have endoparasites and ectoparasites. The endoparasites live within us, like the eukaryotic worms. The Plasmodium, which is featured here, causes malaria. Cryptosporidium is a protozoa found in water that causes diarrhea. May only be killed with hydrogen peroxide, so sometimes we see this more in the summer when children are out swimming in swimming pools that are disinfected with chlorine. Well, this is only killed with hydrogen peroxide, so sometimes we see it in those cases. The ectoparasites, things like lice, bedbugs, and scabies, live on the outside of us. Lice, we place the patient in contact for 24 hours after the start of treatment. Bed bugs, difficult to kill organisms. We have to expose them to very high temperatures. In addition, scabies is an ectoparasite caused by a mice. Causes the pruritic lesions on the hands, web of fingers, wrists, elbows. The incubation is 4 to 6 weeks, but can be shorter if previously exposed. It is transmitted through direct contact with infested skin, requires contact isolation, or 24 hours after the start of effective therapy. Healthcare provider prophylaxis is indicated if the infestation occurs, such as a pruritic cutaneous rash. The itching that is common with the disease is due to a allergic reaction from the mite. Then we have what are known as Norwegian scabies, also known as crusted scabies here. So crusted scabies is Norwegian scabies and is a severe form of scabies that occurs usually in the immunocompromised. Does actually produce less itching. Viral diseases are difficult to treat because they replicate inside the host cell. For example, we have the cytomegalovirus, transmitted through saliva, urine, blood products, and organs. We use standard precautions and no additional cautions needed for pregnant healthcare providers. RSV is one of the most common causes of respiratory tract infection in infants and children, transmitted through direct and indirect contact. This is isolation through contact precautions. Then we have the different types of hepatitis viruses. So here's a graphic depicting these. Hepatitis A is a foodborne illness. Food service workers must not handle food for 7 days after exposure, and you look for it symptoms along with the IgM antibodies to confirm this disease. Hepatitis B is more serious if co-infected with Hep D. It's a high likelihood of transmission via needle stick, up to 30%, but fortunately we have a vaccine available. Dialysis patients that are positive must be treated in a separate room with a dedicated machine. And OSHA does mandate that healthcare providers be provided the Hep B vaccine free of charge. Hepatitis C, no vaccine, low risk via sexual transmission, and there's no restriction for nursing mothers. And hepatitis D requires co-infection with hepatitis B. So hepatitis B serology, so the different tests that are going to be done when this is ordered, I'm going to look for the hepatitis B surface antibody, which indicates recovery from an infection and immunity, or that the person has been vaccinated. If the person has IgM antibodies, then that means it is a recent infection. Hepatitis B surface antigen, it's a protein on the surface of the virus, and the presence indicates that the person is infectious or has been recently immunized. And the total hepatitis B core antibody appears at the onset of symptoms in acute hepatitis B and does persist for life. So you have to take these different tests and the results in correlation with each other to determine if it's an immunity due to past exposure, or if it's an active infection, or what exactly the patient's condition is. Continuing on with viral diseases, epidemic keratinoconjunctivitis caused by an adenovirus. We control this by hand hygiene, and it occurs because the rinsing of the ophthalmoscopes hasn't been done thoroughly. Herpes simplex virus, and then viral meningitis, where the CSF is characterized by normal opening pressure, normal glucose, predominance of lymphocytes in this case, white blood cells of less than 100 per cubic millimeter, normal to elevated protein, and most importantly, the Grand stain is negative here. Measles. Measles is one of the most contagious diseases we have and is characterized by fever, coryza, cough, conjunctivitis, and then you get the Koplik spots in the mouth, and then the characteristic maculopapular rash. Requires immediate airborne isolation. You need to transmit specimens to the lab in a very cool state, and then it requires an immediate report to public health. This is an immediate public health threat. This is a wake up the public health officer type of situation. HIV, detected by antibodies in a serum sample via the Western blot, 1 to 3 months post-infection. It can be followed up with the ELA. Likelihood of transmission is less than 1%. May develop secondary infections like Kaposi sarcoma. We also have a second type of virus here, the norovirus, most common cause of epidemic gastroenteritis worldwide. And lastly, smallpox. Now, smallpox is a deadly disease. We don't see it anymore, but it could, of course, come back. Requires a N95 or higher level of respirator, and has a extreme potential for a bioterrorism agent. Varicella, chickenpox, zoster, if it's shingles, requires contact and airborne isolation if it's disseminated. Healthcare providers should be immune through vaccine or illness. Thus, no special requirements for pregnancy. The virus can cause fetus, so we do not vaccinate during pregnancy. Chickenpox, if immunized, requires no mask upon entry. However, if we have an exposure, we keep the healthcare worker off of work from day 10 to day 28. Shingles, again, if it's localized, the rash can be covered. We keep them on standard. If it's disseminated, again, it's airborne and contact. Influenza. Influenza is spread from person to person through large particle respiratory droplet transmission. The droplets travel less than 1 meter. The incubation is an average of 2 days. Adults shed from the day before symptoms start, which is why all healthcare providers should be vaccinated, because viral shedding does occur before symptoms start and continues from 5 to 10 days after the illness onset. Children and the immunocompromised shed for 10 days or more. There are 3 categories of influenza: influenza A, B, and C. They all contain a single strand of RNA. They are named according to the city or state and the year of isolation. Influenza A is the most common, and it is also the most common cause of serious illness and worldwide epidemics. Influenza B has also caused large epidemics, but it's a milder disease. And influenza C is much less common and mild and has not been associated with large epidemics. And lastly, we have the avian flu. Avian flu, H5N1, highly pathogenic with a reservoir of domestic poultry. The H in the H5 is for the hemagglutinin, and the N is for the neuroaminase. They are both proteins that are found on the outer shell or the envelope of the virus. And they are how viruses are typically named for influenza. So our last disease we're going to talk about, I know it's been a long session, are the prions. Prions are not living, they're pure protein. So when you think of prion, just think pure protein, meaning they have no nucleic acid, so no DNA or no RNA. They are just protein. Prions cause Creutzfeldt-Jakob disease, characterized by rapid neurological degeneration, diagnosed with the 14-3-3 spinal fluid assay. If we use instruments on these patients, it requires very special reprocessing. And then this disease occurs in 2 forms, either the sporadic or the familial. 2 forms of prion disease. That's it for the diseases. I know it's been hard. I know it was a long section. But as always, now that you have learned this information, well done, and you are ready to start studying in the APIC Certification Study Guide. These questions reference the questions from the 6th edition of the study guide. So for example, if you go to Chapter 3, you have a lot of questions in Chapter 3, starting with question number 1. So you read question number 1 in Chapter 3, and after learning the material in the PowerPoint here, you should be able to answer that question, and then you just move through all the other questions listed here, which have been covered in this YouTube video. Again, thanks for listening, everybody. Make sure to like our page, and good luck in your studying.